I'm thrilled to be at a center that helps healthy moms and healthy babies. And that's what our society should be all about, is creating healthy moms and healthy babies. And I am concerned that at a time in which we hear a lot of our colleagues in Congress talk about family values, that they strike at the very core of health insurance that can guarantee that healthy families are nurtured, sustained, and be able to achieve the goals of fulfilling every child's God-given capabilities. And I am concerned about that because one of the things that I helped fight for and made a reality was the Affordable Care Act. And the Affordable Care Act, some others call it Obamacare, but ultimately did so much for promoting maternal health, women's health in general, as well as health care for over 1 million New Jerseyans and many on Medicaid. That is critically important in terms of our health care delivery system. And it did something that was critically important for many 3.8 million New Jerseyans and about 52 million Americans in our country, which is say that if you had a pre-existing condition, which all that means is if you had some type of illness or if you had a difficult pregnancy, that in the past an insurance company could ultimately say, you know what, you had a pre-existing condition, we're sorry, we're not going to insure you. Or we'll insure you, but you're going to have to pay double what anybody else pays. That certainly was an obstacle to families achieving the goal of being able to have a healthy start. And so we eliminated that ability to discriminate under the law. And so critically important to so many of our mothers who have had some challenges, whether with a past pregnancy or a miscarriage or complications during delivery. So I appreciate many of you coming together here in our state to talk about real-life ways in which this is meaningful. Medicaid, for example, is a significant part of how we extended health care for so many New Jerseyans, and it is also a critical part for health care coverage for women in our country, and that is under attack as well. And so in the midst of all of these challenges where the administration, the Trump administration, is in a federal court, instead of upholding the law and making sure that there can be no pre-existing conditions discrimination by an insurance company, they are undermining the law and saying, no, that law is unconstitutional. That's going to mean for 3.8 million New Jerseyans, if that's the way the court rules, we're in trouble. And as we debate a Supreme Court justice to the United States Supreme Court, the nominee is someone who has already taken positions on the D.C. Court of Appeals that has voted against elements of the Affordable Care Act that are critical to our health care. So, real family values means helping each and every one of these young people who are with us today fulfill their God-given potential. That means a healthy start. And that's why I fought really hard, not only for the Affordable Care Act, but for the McVeigh program that is critically important in having home visits for maternal health so that people can get a healthy start in their pregnancy, so that they can have a healthy delivery and that they can have healthy children and help have them be nurtured and grown. So I really appreciate the mothers who are here today, taking time from what I know is maybe the toughest job around.